歡迎大家出席今日嘅
Welcome to today's press briefing. We have with us from the Center for Health Protection, Controller Dr. Edwin Choi, and also from the CHP, Principal Medical and Health Officer Dr. Albert Out, and from the Hospital Authority Chief Manager Dr. Lau Ka-hin. But first hear from Dr. Choi. Good afternoon, everyone. I would like to first give you a report about the epidemic situation before I ask Dr. Ao to speak about the latest data. We have so far recorded 1.16 million cases of PCR or RAT positive cases. Starting from the peak at the beginning of March, we see a decreasing trend. Between the 3rd of April and the 5th of April, we have recorded about 3,000 cases per day. The trend is decreasing. However, 3,000 is still a high number. We expect a high number in the coming holidays, so there is a risk of rebound. We ask you all to be vigilant. Please reduce unnecessary activities over the holiday. We've always been concerned about cases or outbreak in care homes for the elderly and those for the disabled. For these care home residents, they are high risk because they are frail or they are elderly. And in this wave, we have seen outbreaks or cases in most of the care homes. We're talking about over 1,070 homes. That includes 707 elderly care homes as well as 290 care homes for the disabled. We have over 48,600 residents being affected and over 12,800 staff members. Government teams, HA staff members, healthcare teams at care homes have been adopting various anti-infection measures to keep the infection numbers down. RAT tests have been carried out daily to identify infected persons. We have also enhanced the isolation facilities, vaccination effort, as well as the use of oral medication to reduce fatalities as well as serious cases. In the 5th wave, we have conducted some case analysis. As of the 5th of April 2022, in the 5th wave, for case reported in the past 7 days amongst care homes, starting from February, there was a surge in number of cases. At the beginning in February, we have less than 100 care homes being affected. And between the 3rd and the 10th of March, we have 661 and 671 homes being affected. At the end of March, the number has dropped to about 300 homes. As at the 5th of April, there are still 265 care homes that have had cases in the 7 days ago. Between the 30th of March and the 5th of April, there are about 41 to 91 homes being affected per day. This shows that although the number has dropped from the peak, it's still quite at a very high level. We should remain vigilant and we should implement all necessary infection control measures at care homes. Vaccination is an effective way to reduce fatalities as well as serious cases, especially in care homes. We've spared no effort to boost the vaccination rate. We have already reached our first stage objective in relation to care homes. That is, before the 18th of March, we have for 1,100 care homes administered at least the first dose for residents. As at the 5th of this month, we have those who have received the first dose over 44,700 people. As at the end of March, we have about 57,000 and 17,000 residents in care homes for the elderly and care homes for the disabled respectively. Some of them are not fit for vaccination. Later, we will make arrangements for them to be vaccinated. In March 2022, the rough average coverage for the first dose was 54% for care homes for the elderly people, and 69% for care homes for the disabled. We will, before the 14th of May, make arrangements for at least 2 visits to be done at these care homes to administer the second or the third dose. For those who've been previously infected, if they waited for 4 weeks, then they will be able to receive their first dose. We'll continue with our vaccination work in order to boost protection for residents of care homes. We appeal to all those who are staying at care homes to receive the first, second, or the third dose as soon as possible. I now defer the floor to Dr. Au. Good afternoon, everyone. I'll report to you that yesterday, in relation to number of cases of COVID-19, yesterday for PCR positive cases, we had 1,489 cases, of which 223 of them were confirmed by the HA, 284 by Public Health Laboratory Service, and the remaining 973 were picked up by private labs. Yesterday, we had 1,288 members of the public who have been tested positive using RAT, and they've made a valid report on the platform. We have altogether 2,777 positive cases yesterday. So far in the 5th wave, we have 1,167,960 cases. There are 734,111 PCR positive cases. (433,849) RAT positive cases. Of the positive cases yesterday, 7 of them are imported cases. The remaining 2,277 cases are local cases. I'll talk more about the imported cases. There are 2 cases that were picked up at the temporary sample collection center. These 2 people arrived on the 5th from Belgium and Canada. The other 5 cases were picked up in a quarantine hotel. 3 of them was on the 5th day PCR test positive. All of them arrived on the 31st of March by EK384 from Thailand and Bahrain. And the other ones were picked up on the 4th day by RAT. It was someone from Japan and UAE on the 1st of April. In relation to genome sequencing analysis, in relation to 1,066 cases we've conducted analysis, we have not identified anything that carries L452R positive. 1,058 cases are confirmed to be negative to L452R. That means they are Omicron cases. The remaining 8 cases have insufficient viral load. In relation to residential care homes, there was no homes that have previously been reported that have new cases, and 45 homes have new cases and they've been previously affected. There are 41 elderly care homes as well as 4 care homes for the disabled. We're talking about 55 residents in care home, 55 residents and 6 staff members. In relation to the latest death figures, there are 8,247 death cases, an increase by 111 cases. The current death rate is 0.71%. The age range is of 11 months and 112 years old, median age 86. Median age 86. There are 8 pediatric patients and 320 cases that are adult. We have 7,917 death cases that are above the age of 60. That accounts for 96% of all death cases. 5,850 cases that are above the age of 70, which accounts for 70.9% of the overall death rate. In relation to vaccination, 67.2% of death cases have no vaccination record. 21.4% of them received no or one dose, and the remaining 11.4% have received 2 or more doses. In relation to death rate, for those that are unvaccinated compared to those who have received vaccination is a lot higher. Overall speaking, for those without any vaccination, the death rate is as high as 3.26%. Those with one dose, the death rate drops to 0.97%. Those with 2 doses, 0.14%. 3 doses, the death rate drops to 0.03%. For those above the age of 80, if they are unvaccinated, the death rate is as high as 16.6%. Those with one dose, the death rate drops to 6.9%. Those with 2 doses, 3.4%. 3 doses, 1.04%. That's all for my report. We'll now hear from Dr. Lau from the situation about the hospital authority.
We have 10,068 patients admitted to HA hospitals, North Lantau Infection Control Systems, AWE, German facilities, and we have more 13 additional patients who are in critical conditions. 8 are serious, and 74 are staying in our ICU. As at the midnight, we have, for the past 24 hours, 84 patients passed away, 55 men and 31 women, aged from 43 to 112. For those who passed away yesterday, 40 are from care homes. 50 have no vaccination record. 21 has received 1 dose, and that is 71 patients did not complete the whole vaccination, or 80% of the deaths. 11 patients received 2 doses, 2 patients received 3 doses. For those who are over 65, there were 77 deaths. And I would like to highlight the 3 relatively younger patients who died. And the first one, 43-year-old, suffered from brain hemorrhage and damage to brainstem in 2017, and he required the use of breathing equipment for a long time. He was hospitalized all the time and required full-time care. So he's a chronic patient. On the 12th of March, the patient was tested positive for COVID. So we administered different interferons and other drugs, Remdesivir to him. Another one, 59-year-old patient, has suffered from renal failure and had to undergo renal dialysis. And he also had blood vessel problems of the heart. And the patient was admitted because of shortness of breath. During the hemodialysis, there was shortness of breath, and therefore he was admitted and he passed away, unfortunately, yesterday. The third one was a male patient, 59 years old. He suffered some chronic diseases, lung cancer, and it has spread to many parts, including the bone, and it was suspected that to the brain as well. Some chemotherapy was carried out recently. Now let me turn to some cases related back to the period 22nd of February to 4th of April. 27 deaths, 14 men and 13 female, age between 36 and 95. I would like to particularly highlight the 36-year-old patient who suffered from chronic diseases. Something about the coronary, the blood vessel problem, and also heart problem. And the patient had poor appetite, and the hemodialysis fluid showed some color, and the patient was tested positive for COVID, and then an antiviral COVID medication was administered. Some 655 patients have now been discharged. And for those who have been tested positive on admission, we have 10 more now. And another 10 patients in the same cubicle or ward are now classified as close contacts. As for staff, we have so far 21,337 staff members who have been infected, and 19,449 have returned to duty. Now, we now have a Q&A session. Please tell us your organization before you put your question, and because of the time issue, please be succinct. I'm from TVB. First, about the loop, the hospital in the loop. Would the hospital for acute cases be manned by local personnel or mainland helpers? And now we have 2,700 cases for the day. Can we expect a declining trend from now on, since things seems to have stabilized? As for the usage of the holding isolation centers, what's the utilization rate? As for the 36-year-old patient who passed away, and it's said that some medication had been administered, can you tell us more about the cause of death and in spite of the medication administered? I would defer to my colleague on the oral medication and the acute hospital. Yes, it's very obvious that the number has dropped from the peak in early March. And yesterday is 3,200. Now it's 2,700. But the figures can fluctuate over time. The day before had a lower figure. Yesterday there was a rise, and now we have a drop for today. Compared with 3 months to a few months ago, yes, there are now fewer cases, but still 2,700 is a high level. We are really concerned that after the holidays, if we have a lot of people gathered for various activities, there will be a rebound. Although there's a downward trend now, I hope members of the public will be vigilant that there are many transmission chains in the community. People should remain vigilant and avoid unnecessary gatherings. Let's control the epidemic as soon as we could, and then people can return to normal life. For the loop hospital, our understanding is that the mainland health workers will be providing the care. We would arrange for some patients to be admitted there, and if we have further information on the arrangement, we would inform the public accordingly. For the 36-year-old male patient, as I have said, he suffered from a number of chronic diseases, such as aortic dissection, and also endocarditis, and he had the heart membrane valve replaced. He was admitted to an A&E department on the 30th of March, complaining about a poor appetite and constipation for 2 days. The RAT administered was negative. He also mentioned that the dialysis fluid was not transparent. He suffered from late-stage renal failure, and we understand that in renal dialysis, if the fluid is not transparent, it shows some information problem. Every patient upon admission will be screened, and we then discovered that he was tested positive. Although the patient was not very old, but because of the diseases, and he was considered risky. So we administer the antiviral medications, but his condition continued to deteriorate despite that. We administered oral medication to him every day, and on the 4th of April, he unfortunately passed away.
Next question, the lady at the far side, on the far side. I'm from Cable TV. I have 3 questions. First, about the 43-year-old patient. Just now you mentioned that he relies on a respirator. Is he mobility impaired? Is it a case of infection in the hospital? Is it the case that infection control is not properly done in a hospital? And I'd like to also ask about epidemiological tracing. Now the number of cases has dropped to about several thousand. Would you resume tracing work? Some experts said that, investigations should be done about the whereabouts of the infected instead of having them report their whereabouts. This may be better, but if that is to be done, how is it going to be done? And today, the chief executive said that when members of the public enter certain premises, they will have to do RAT test. Do you have any details? When will they start, and what about the details of operation? I'll defer to Dr. Lau about the 43-year-old case, and I'll defer to Dr. Au about contact tracing. Then I will answer about RAT tests. In relation to the 43-year-old patient, in 2017, there was a cranial hemorrhage. And that's why the person had to rely on a breathing machine. The patient could not really communicate. Starting from 2018, the person was staying in Wong Tai Sin Hospital. In 2021, the person was transferred to Graham Hospital. It's more of an infirmary, not exactly a hospital, because the patient's mobility is immobile and requires long-term care. On the 12th of March, a test was done and found that the patient was tested positive. We prescribed some interferon as well as remdesivir to the patient. The patient's condition is quite poor all along and is bedridden. Even with the medication prescribed, the patient's condition did not improve and regrettably passed away yesterday. I'll now defer to Dr. Au about epidemiological tracing. Currently, we make use of 2 online platforms, one for PCR infected cases, the other one for RAT positive cases. We make use of these to online platforms to gather basic information of the infected, say, for example, address of workplace, occupation, and personal risk factors. Our approach is to isolate the infected as soon as possible. On top of that, we will arrange for household contacts who are high risk to be quarantined. Given the sheer number of infected cases, we make use of questionnaires online to gather information so that we can, as soon as possible, issue isolation order to the infected and to household contacts quarantine order. We now focus on household contacts because they're subject to the highest risk. And they are people that the infected person comes into contact with when the infected person was most contagious. So the risk was rather high. Quarantine will have to be arranged. In relation to epidemiological tracing, when the number of confirmed cases drops, we may issue CTNs, compulsory testing notices. We have been doing it already. We make use of the online platform, as I said, to gather information about the place of residence of infected cases. If we find buildings with a high number of infected cases, then it will be included in the CTN. We ask members of the public to get used to using the Leave Home Safe app. The app will record the places that you have visited in the previous 30 days. This will help us in our tracing work. I will supplement about cases investigation. Starting from February, we make use of an online platform for reporting. It's been quite effective. If it's a PCR test positive, the patient will use the online platform to give us information. This is the first step. We gather basic information such as home address, household members in relation to the case. If you read our online questionnaire, you know that we also ask about workplace as well as occupation because we have seen outbreaks at workplaces. From the information we receive from the online platform, then we will be able to identify any irregularities or risk of outbreak at workplaces. We will call the infected person to ask about conditions of the workplace. And if we've identified any outbreaks at the workplace, we'll contact the company. Sometimes, with just a bit of advice, the outbreak can be quickly controlled. When we see any signs of a cluster, we will follow up. In relation to the use of RAT, the current number of cases is still high. Drawing reference from experience of other places, this high level of cases may remain for some time. It's very rare that the number of cases will drop to a very low level within a short time. If people resume their gathering activities, then the 3-digit figure may be with us for quite some time. We, of course, would like to identify cases as soon as possible. For a lot of workplaces, a daily RAT is required. That includes those who work at care homes, those who work at the front line to fight the epidemic, HA staff members, and those who work at construction sites. These tests are done on a daily basis. If one is exposed to high risk, and if the test is done every day, and if that person is positive, then we can immediately ask that person to refrain from going to work to cut this transmission. DSC candidates will also have to get tested on a daily basis using the RAT. Well, if we have identified high-risk candidates, then they can be sent to a dedicated examination venue to sit for the examination. And as to what special activities that will be covered by the RAT, currently we don't have anything in mind. Perhaps on the 21st of April, there may be changes with the social distancing measures. We will see whether RAT requirements will be incorporated for certain activities. After we have distributed the anti-epidemic service bags, we hope that members of the public will get used to using RAT kits. And in the future, if it is necessary to use it to meet certain requirements, it will be easy.
Good afternoon. English questions from the South China Morning Post. First, about the online rat declaration platform. So some people have missed the deadline on March 14 to submit their data. Can you give a figure on what the backlog number is? And for the people who are sending email directly to the health authorities to declare their infections, what kind of proof will they have for their infection? And second question is about the prescription of oral pills at private clinics. How many private clinics have been distributed these oral pills, and how many pills have been prescribed through the private sector so far? A third question is on the residential care home infections today, the newly found ones. Are these reinfections within care homes that had previous infections, or are these repositive cases as a result of residual cases among the people living there?
Okay, thanks for the questions. So I think I will first respond to the first question on the online reporting, and then I'll invite Dr. Au to supplement on the details of the information which we request for the online reportings, and also Dr. Au may respond to the RCHE the case, and then I will invite Dr. Lau to respond to the private practitioners prescribing the antiviral drugs. Okay, for the online reporting through the RAT report, so we would like to appeal to members, the Hong Kong people, that they have to report their positive result to us via the platform within 24 hours. This is because we want to make sure that we receive the case promptly to initiate any investigation and also the control measures promptly. And most importantly is because if we want to check if there is a false positive, there's a window period for us to check. So this is very important for us to implement all those measures in a promptly manner. So for those who, we have a retrospective reporting period from the 26th of February to March 7th. So we allowed a 1 week period for reporting these retrospective reports. But we noted that there are some Hong Kong people, some citizens, which are not very familiar with the current reporting functions, that they miss some of the SMS messages, or they have some technical difficulties in uploading their Hong Kong IDs. So we allowed some flexible arrangement that they can further provide us some information so that we can help them to issue the isolation order to them in the manual way. So maybe I'll let Dr. Au respond to you about what information we are now asking them to provide, and any updated statistics on this kind of flexible arrangement.
Thank you, Dr. Choi. Maybe I will supplement about the retrospective reporting. As mentioned by Dr. Choi, we encourage the citizens, if they were tested positive by RAT, then they should immediately or report within within the same day or the next day to the Department of Health, so that we can arrange control measures in a timely manner. And also we want to monitor the new cases, but not the retrospective cases. But we understand that there are certain citizens who could not be report to our online platform timely due to various reasons. For example, due to some technical reasons, or for example, they don't know how to access the internet, and they can only find help a few days later, so that they could not be reported within 2 days. So we allow them to submit their applications through email, ratp@dh.gov.hk. After we receive the email, we will assess each individual cases to see the reasons for delayed reporting. If the reason is acceptable, and then they need to submit they need to complete the registration process. They also need to submit us the personal information, the same as those collected through the online platform. And they have to provide us their address and also personal information, including sending us the Hong Kong identity card and also the photo of the positive test, so that we can process their applications. If we think that this is a true case, and we will assign case number and also issue back the isolation records for them. For the RCHE and also the RCHD cases, yesterday there were 41 RCHE which have previously recorded cases or outbreaks. They still have new cases reported to the Center for Health Protection yesterday. A total of 55 residents. Their new cases occur in 41 RCHEs which had previous outbreaks or cases. And for RCHD, there were a total of 6 residents reported from 4 RCHDs previously have recorded with cases. So there are a total of 61 residents in new cases in 45 institutions yesterday.
So maybe double out the response to the prescriptions of antivirals by the private practitioners.
As far as I know, the government is setting up an electronic platform for ordering and distribution of the true oral antivirals, similar to the COVID vaccine system. And the drugs will be distributed to the requesting doctor's clinic for prescribing. And Department of Health will timely release the details and inform the private doctors. But the hospital authority will do our best to complete this task, and also to help the private practitioner to get the antivirals as soon as possible.
我哋問最後一條問題，前邊嗰位。
Hong Kong 01, I have just one question, and that is about a particular case. A 56-year-old woman who have no chronic disease, who previously was infected with Omicron, and this week she fainted and was sent to hospital. That was critical at one stage, and now she suffered from pneumonia. Is it something got to do with her previous infection? I don't think we can judge whether she suffers from pneumonia, because there are many causes, medically speaking, many causes of pneumonia. It can be caused by bacteria or virus or other causes. So she had a medical history of COVID-19 infection. Well, whether it's related to her present state would have to be subject to a study, an in-depth study. So it's difficult for me to say whether her pneumonia now has got anything to do with the previous infection.
I don't have sufficient information on hand, but Dr. Choi is right. When a patient comes to a hospital, we will take into account the person's medical history, medical record, results of various investigations before deciding on the treatment. If it is pneumonia, then we will provide the most suitable treatment. I would like to say something about what you've asked. Majority of people infected with Omicron are either asymptomatic or mild symptoms, but there are also high-risk groups. They are above the age of 70, under the age of 5, those who are pregnant or immunocompromised people. So even with Omicron, which is milder than Delta, you will still have to be careful because Omicron itself is not an ailment. If one is unvaccinated, there may be complications which include pneumonia. If you are concerned, if you are unvaccinated, if you are from the high-risk group, please get vaccinated as soon as possible. That's the message I'd like to disseminate. But I'm afraid I am unable to give you more information about that particular case. That's the end of the press conference. Thank you.